Gurmagat Shankorla, Gurmagat Asocht, Digandoman, Shesht, Tavtuk Shaw, Hogail. I think that health is hugely important. It should be a priority. But dental health is an intrinsic and very important part of the health equation for most people. And it's well testified that where people do not look after their dental health, that it has other detrimental effects on their well-being. And the reality is that the medical card dental scheme is falling apart. There's a population in County Galway of about 300,000 people, so we can guess that there's about 100,000 medical card holders. There are 24 dentists in the scheme. And these obviously have a large number of private patients. To cover those, each one of those dentists, as well as their private practice, would have to cover 4,166 patients each. That's clearly impossible. And therefore we have a huge challenge that we meet, I think, in the constituency clinic all the time, of people who have medical cards who cannot access routine but vital medical treatment. And the reality is, in cases like that, many people wind up getting teeth extracted, and we know the options when that happens are either very expensive or not very good, and they're certainly suboptimum, taking modern dental practice into account. Recently, I got a heartbreaking letter from the Galway Advocacy Council. And this is a group supported by Fáilte Community Services in the Brothers of Charity. And this group would mainly deal with people with disabilities and their experience with the dental services. What they have said, and these are people with an intellectual disability, if you haven't seen a dentist in a year, you'll drop off their books. A person has to go to Shantala Clinic, which is the public clinic for extreme emergencies, to be seen as they were in pain. Dentists are looking for the bank details ahead of appointments. What is the point in having a medical card? Dental services have gotten worse in the past 20 years, which they certainly have for the people dependent on the medical card. Do dentists want to deal with medical card holders? Is there a lot of paperwork? People should not have to suffer or be in pain. This is wrong, and I think all of us who have ever suffered from diarrhea or dental pain or toothache know how excruciating a pain it can be. What's going on in the country? And that's a very valid question. At a time that there's unprecedented wealth in the country, a simple service such as a medical card dental service doesn't really seem to exist in any meaningful fashions. People have lost interest in going to the dentist due to lack of appointments for medical card holders or no money to go private. They're losing their teeth, their smile and their confidence, but it's also affecting their health. So, Minister, I beg of you here, it's unfortunate that there was no health minister available, but I would hope that you carry the message back that there is a crisis in the provision of dental services for medical, and to go private is unaffordable.
Minister.
Thank you, Councillor, and I wish to thank the Deputy for the opportunity to address the issue of participation of dentists in the Dental Treatment Services Scheme in County Galway. The Dental Treatment Services Scheme, or DTSS, provides dental care free of charge to medical card holders aged 16 and over. Services available annually and on demand include an examination, including preventative advice, tooth fillings, emergency extractions and a scale and polish. More complex care, such as dentures and a broad range of treatments for patients with additional needs and high-risk patients, are available, subject to the approval of the local HSE principal dental surgeon. In response to contractor concerns regarding the scheme, the Minister for Health approved measures from May 2022 providing for increased preventative care and increasing the fees paid to dentists for most treatment items by 40 to 60%. While the number of contractors on the scheme remains decreased relative to before the pandemic, with there being 57 contractors on the scheme in County Galway at present, the number of treatments provided by contractors on the DTSS has increased since the new measures were introduced. In 2022, 40,580 treatments were provided at a cost of €2.23 million in County Galway. In 2023, 44,646 treatments were provided at a cost of €2.81 million. However, the Minister is aware that medical card holders in some areas continue to have difficulty accessing care. The HSE are required to support the provision of emergency care to adult medical card holders who are having difficulty accessing a local dentist. The Government is committed to fundamentally reforming dental services, including the DTSS, through implementation of the National Oral Health Policy, Smile Agus Sláinte. The Department is working closely with the HSE to ensure the establishment of focused structures to drive implementation of the policy. The HSE has appointed a strategic reform lead to drive policy implementation across the organisation and to move forward in 2024 with developing new services for both adults and children in line with the policy. This will include work on planning new services for medical card holders. The policy highlights the need for a strategic workforce planning to ensure a sufficient number of appropriately trained oral healthcare professionals, to include dentists, dental hygienists, dental nurses and other auxiliary grades. It is heartening to note that we currently have more registered dentists in Ireland than ever before, 3,649 at present, which is an additional 177 registered dentists since March 2023. This reflects positive trends, with the comparative figure being 3,217 in 2018. The Minister supports the creation of additional capacity in higher education, including in oral health care, and the Higher Education Authority is undertaking a process to identify a set of options to achieve this important step towards health workforce sustainability for Ireland. Thank you.
To thank you for the information, but I have to say that dealing with my constituents, the lived experience, irrespective of the figures, do not concur with what was stated in the script that you were provided with by the department. And to be quite honest, if you have a free scheme, it's a free scheme, and the cost becomes irrelevant to the person seeking to access the scheme. We shouldn't give a commitment if we're not going to honour the commitment, irrespective of the cost. Now, you say there's 57 contractors. It's quite recently that we went and looked for a name of the dentists that were on the scheme. And we were given 2 in Galway West, 9 in Galway East and 13 in the city. I will go back and see is there an updated list and that it has more than doubled in the meantime. But that certainly wasn't the information we were given. And obviously I will be raising the issue here again if the 57 doesn't stand up in reality, because as you know, it's an important thing that the facts and figures we're given here on the record are accurate. As I said to you, the lived experience is that people cannot access routine treatment. And I hear what's said about emergency, but an emergency should be an emergency. That shouldn't be the routine way to go. And we also know with dental health that prevention is way, way better than cure. And that early intervention in relation to cavities, to issues that arise with dental health, are far, far superior to trying to solve a problem that should have been avoided. And can I finally say, could you particularly mention to the Minister the challenge faced by those with a disability, and particularly since they raised the issue with me, with an intellectual disability, They do not have the same ability to fend for themselves in trying to negotiate a complex bureaucratic system. Will somebody make sure that they get access to genuine, free dental care as promised?
Thank you, Deputy Ó Cuív. Minister, to conclude.
Thank you, Deputy. The Minister has made substantial additional investment in oral health care services in recent years, but I very much take your point in terms of the lived reality that you've outlined, and in particular in relation to people with intellectual disabilities trying to negotiate complex administrative systems when they're not always very user-friendly. Certainly take that point back to the Minister. I'll try and get him to supply that list of 57 contractors to you as well. But thanks for raising the points that you've made, and I'll take the message back to the Minister for Health. Thank you.